Hello everyone, my name is Sam. I'm a GP. Today I'm going to talk about a topic called cough. Cough is a very common presentation to general practice. So it is very important that any medical student or medical practitioner should familiarize themselves with a list of common causes of cough. And also to have a system of thinking through the pathological process that can bring about cough. Before we move on, let's take a look at the anatomy of the chest. Here's a diagram of the chest. Under the rib cage, we can see that there's a right lung, the left lung, the heart in between the lung, and the esophagus behind the heart. Here is a more detailed anatomy of the lower respiratory tract. When we breathe air goes through the nose, into the mouth, and then into the larynx. The larynx is a voice box, and it contains a structure called a vocal cord here. So air flows from the larynx through the vocal cord into the trachea, and then into the bronchi, and then into the bronchioles, and finally ends up in the alveoli. The alveoli is a space where the air, because of the large surface area, can diffuse quickly into the capillary system in the lung. Is then returned. The air is then transported in the blood, is returned to the heart, which then pump it to the rest of the body. Here's a table of the common causes of cough. I have classified the causes of cough into different pathological processes. The mnemonic I use is INTO, I for infective or inflammatory, N for neoplastic, T for traumatic or toxic, O for obstructive or compressive, and O for others. Before we go on, it is very important to know that cough is actually a natural reflex, a natural process that allows the body to expel inhaled irritant that have ended up in the lower respiratory tract. So any cough is actually a response to irritation within the lower respiratory tract. So within the lung, any infective process such as pneumonia, atypical pneumonia, lung abscess, whooping cough, influenza, and tuberculosis can all cause irritation, therefore cough. In a similar way, inflammatory process such as interstitial lung disorders and sarcoidosis can also bring about cough. Lung cancer, which is a neoplastic process, as it grows bigger, can compress and irritate the lung structure, and as a result brings about chronic cough. In a similar way, asthma is a condition which causes obstructive process in the distal small airway within the lung, causing wheezing and coughing. In a similar way, bigger airways such as the bronchi and the trachea can be inflamed and therefore irritated. So infective process would include acute bronchitis, chronic bronchitis, bronchiectasis, and cystic fibrosis, all of which can cause cough. In younger population, we have to think about the foreign body as a differentiator, because foreign body can be unintentionally inhaled or swallowed by the young child and landed up in the trachea or bronchus. Upper airways generally is not a common cause of cough, because upper airway irritation or infection usually results in runny nose, sinus congestion, or sore throat. It usually results in cough only if there is significant or postnasal drip that drip down the back of the throat and irritates the vocal cord or the lower respiratory tract. Needless to say, smoking is also a very common cause of cough. Other than the lung, other structures can also bring about cough as a symptom. For example, the esophagus can allow the acid to reflux from the stomach backward and upward into the larynx and landed within the larynx itself, irritating the vocal cord, or gone beyond and irritate the airway. In particular, the name of the condition is known as laryngopharyngeal reflux. And finally, the heart can also cause cough if a person is in left ventricular failure. Thank you very much for your attention and for watching this video. This is a disclaimer. This video has been made available for information and educational purpose only. The information contained in the media represents only the view and opinions of myself. The video is not intended to diagnose, treat, cure, or prevent disease. Please always seek the advice of your personal health professional. Thank you.